Hello everyone, today in series of DocPlexus interview, we have with us Dr. B.A. Muruganathan, who is the B.C. Roy Awardee in 2005. He has received Lifetime Achievement Award from Dr. MGR Medical University in 2011 and KG Foundation Coimbatore in 2008. He has also been awarded IMA Dr. MG Garg All-Time Achievement Reward from National Indian Medical Association in 2014. Hello sir, welcome to the DocPlexus interview platform. So today's topic of discussion with you would be simplified protocols for improvement in management of hypertension. So sir, my first question to you would be, can you brief us about the epidemiology of hypertension in India?
Well, hypertension is a big public health problem. Also, it's a burden to the country. There are nearly 200 millions of people are having hypertension, and every state now aggressively promoting this simplified protocols to make the control more effective. In India, with all the knowledge, with all the health literacy, with all of us involved in this, only 15% of the people are under control, and the sad story is many are not aware that they have a hypertension. Those people who are aware also, they don't take treatment, and those people who take the treatment also, control is not there. So our job, our hard task ahead is to make them understand, to make them aware, follow up, and then control. When you control hypertension, you can prevent so many complications like CVA, cerebrovascular accident, hemiplegia, kidney failure, eye problem, heart attacks. By preventing, the country can save so much of money. See, and so many lives can be saved. In Canada, the control is very good, around 60 to 65%. By controlling that much, they can save millions of lives. That is why the WHO, the Vital Strategy, and the Government of India, all the state governments have started Indian Hypertensive Management Initiative. So, Resolve to Save Lives is one of the international organization in which I am the senior consultant. So, we have started the simplified protocols, and 5 state governments are following this.
Yeah, what are the major factors related with low hypertension treatment and control?
Now, as I said, first the awareness and understanding is not there, and people who are educated also, they take treatment, and once the blood pressure is under control, they think the blood pressure is cured and they don't take. Once somebody has got blood pressure, we must make sure that they continue the treatment lifelong, and that they should understand. Number 2, the patient empowerment must be there. We must make them understand, and we must also provide home blood pressure monitoring, just like home blood sugar monitoring. So, when patients are involved in the treatment process, the control will be better. So, home blood pressure monitoring we must promote. It is very cheap now, and I always insist the doctors who are treating the patients must also educate them how to use the home blood pressure monitoring.
Okay. So, as hypertension is more of lifestyle disorder, so how far is genetics associated with hypertension?
Well, see, 90 to 95% of the hypertension we do not know the cause. It is more like we call it as essential hypertension or primary hypertension. Only 5% of the people we can know what is the cause. It may be due to secondary to endocrine disorders, or it can be due to congenital coarctation, things like that. The primary hypertension, of course, there are some genetic roles, but generally, that's why we say when somebody comes to you for fever or diarrhea or headache, we must check the blood pressure, and there is an accurate way of measurement of blood pressure is necessary to identify people at the early stage and put them on the treatment, and then lifestyle modification. The first treatment is lifestyle modification. For 1 or 2 months we observe, if the BP is not under control, we put them on to drugs. So, lifestyle it is of course one of the non-communicable disease. The hypertension is so important because all cancers put together, the deaths are more in hypertension. That is why we are alarmed and we are interested to introduce the simplified protocols in the country.
Okay sir, so what are the associated clinical consequences of hypertension variability?
See, hypertension variability is in somebody has blood pressure in the morning something, afternoon something, and it goes up and down. When somebody has got that much variable, they are the people who develop problems. See, there are chronic hypertensions who are having, let us say, a figure of 160, 100. They may not develop sudden problems. The people who are under control suddenly goes up and down, and not under control, variability with BP variability, they are the people who develop problems. So we must control the BP variability also. To find out the BP variability, one should undergo home blood pressure monitoring or ambulatory blood pressure monitoring, because by checking only once at a clinic, we cannot diagnose BP variability.
So as hypertension is highly prevalent in India, so what is your opinion about major steps that can be taken to increase awareness about hypertension?
Yeah, this is what I said. The Indian Hypertensive Management Initiative, supported by WHO, state governments and central government, and resolved to save lives, we have introduced a concept called simplified protocols. Like DOT, we give direct observation therapy for tuberculosis. Just like that we started. So every small village, small primary health center should initiate this process. The treatment is like this. The newer guidelines, ACC guidelines, European guidelines, every guideline says only four class of drugs for hypertension. One is calcium channel blocker, other is ARB, the third is ACE inhibitor, fourth is diuretic. So you start among the four drugs, one drug first. And we in India, we have started this process. 5 states are following. Like Kerala, you are in Kerala. Kerala, what they are doing, if somebody comes to you in primary health center, they see the blood pressure. If the blood pressure is around more than 140/90, they tell them to undergo lifestyle modification. And then if the BP is not under control, they put them on first amlodipine 5 milligram. And the patient comes back to you. If there is no control, then you put them on telmisartan 40 milligram. And third visit, if there is no under control, then you add them on 80 milligram of telmisartan. If still not under control, fourth visit they add them on, they put them on 10 milligram amlodipine and 80 milligram telmisartan. Even if it is not under control, they add 12.5 milligram of chlorthalidone and diuretic. Even if still not under control, the patient should be referred to specialist to rule out resistant hypertension, to rule out secondary hypertension. The main problem with all these people is, you asked me a question, adherence. Nobody takes regularly. Even educated people, when they go to Chandigarh or Jaipur, they forget the medicine tablet and 3 days they won't take. And even the doctors, when they take medicine, they don't adhere. So adherence is a lack of one. And for economically poor people, when you go to a primary health center or a government, same drugs may not be available. This time you are giving amlodipine. When you go, the supply is not there. So what we are doing from the Indian Hypertension Management Initiative, we are seeing to that all the primary health centers and government supply the drugs throughout the year, and the same drugs, and they check the blood pressure with a uniform BP meter. So by doing all that, and then we are also giving about lifestyle modification in the regional language. So 5 states have taken up this project of simplified protocols. One is Kerala, the second one is Punjab, third one is Madhya Pradesh, Maharashtra and Telangana. Sooner all the states will follow, and by doing this we are hopeful that the control will be better. And patient empowerment is one thing, and awareness, creating awareness is another thing, and sending the messages and following up. Suppose somebody comes to a primary health center, and if the person doesn't come, they will send a message, WhatsApp message. And soon we are also going to introduce a mobile app for the doctors. So that app, if somebody comes to the doctor, even private doctor, and the private doctor can enter their details, and that will send periodical messages. So the app we are going to introduce through this Indian Hypertension Management Initiative, which will be useful for private doctors, because 70% of the people go to only private doctors, and private doctors, they follow with this app, easy to control. So we are hopeful that by year 2020 or 21, we will achieve more blood pressure control. By achieving more blood pressure control, we can save millions of lives.
Thank you, sir. It was really a great session with you today, and we are also hopeful to have more sessions with you in future. Thank you, sir.
Thank you.